Secretary Matt Hancock. Matt Hancock, thanks very much for joining us this morning. Good morning to you.
Good morning.
Morning. This is very worrying, isn't it, that we could see a significant number
is doubling about every 8 days, so we do need to take action. Yesterday I took action in the northeast, working with critical that people follow these rules, follow the rule of 6, follow local restrictions if you have them in your area, and also that if people not coming forward for a test if you don't have symptoms, but instead doing the self-isolation if you've been requested to try to get through this and get this back under control.
The fact of the matter is, Health Secretary, as you say, we all know the rules now, the rule of 6, the more simple way of saying what we need to do, fine.
Yeah.
People aren't doing it. We spoke to the Mayor of Liverpool today. He has said he wants national lockdown now because there needs to be a stop. We are seeing now what the virus understood to be doubling every 7 to 8 days, with more than 3,000 cases reported just yesterday. Now, before national lockdown is imposed.
Well, we are now taking more local action. We have far more tools that are...
Health Secretary, I'm talking about the national level.
I know, and I'm answering it this way to say that we now have far more tools at our disposal. You know, as we saw in the spring, it is the thing that we can do to keep people safe if that's needed. So we're watching vigilantly, but we can see this number of cases accelerating, and of course both are so important.
How prepared are you to impose a national lockdown if these local measures, these regional measures, don't work, if it does?
Well, we don't have yet a local lockdown measures in Liverpool, and so the local lockdowns have been seen to be effective. Doing their part. And Naga, I think, you know, the warning overnight is salutary to do what we all, every single one of us as citizens, needs to do.
I think you've made that message. You've made that message very clear, Health Secretary. I do kind of want to get to the nitty-gritty of this and get some clarity. Lockdown, but effectively will mean everyone is under the same rules.
Well, if you think about it, the social distancing rules, they apply across the nation, the rule of 6.
Oh, look, but they're not working. This is why you've had to introduce more regional lockdowns. I'm talking.
And it's really important for every single person watching this programme. We shouldn't, it would be wrong to, but what we do say is lightly, but the big hope that we've got is if we can come together and serious situation.
I'd like to hear what you've been told in terms of briefing by chief scientists. Are we going to see? What numbers are we going to see?
Well, obviously we hope to avoid that. We publish the information that we have. Decisions on.
No, sorry, those are retrospective. I'm asking you about what you've been told, what you've been warned about. And that has obviously concerned you, rightly. Well,
there isn't a precise figure on it because we all know these are uncertain times. I mean, of a pandemic. The good news is, for instance, this morning we're able to protect people in social care. We're massively more and better prepared on that front, and obviously the mass testing, you know, we've got, which is huge compared to last time.
We will talk about testing. Let's do that. We had Dr. Hickinson, who's consultant in emergency medicine, was before the pandemic. He says that hospitals are running at full capacity. When you talk about social care, can you now guarantee if hospitals are close to capacity and dealing with things other than coronavirus at the moment, and we're seeing an increase in the rate of infections, can you guarantee that now, as we saw at the start of lockdown and the start of the pandemic, that people won't be moved into care home settings.
Things that we've learned is because of the asymptomatic transmission, and we have that testing capacity on an extra £2.7 billion for today, and it's in social care to help protect people, because of course, as we well know, some of the most vulnerable to the disease are in social care.
I'd like a couple of questions on testing, if I may,
Sure.
while I have the time with you.
It's obviously critical, and we've all seen, especially this week, the challenges part of it, just to get the samples into the right slots, next generation technologies, one of which DNA Nudge is in the news today because it can do a rapid turnaround. We're backing loads of those new technologies.
By when? 500,000 by when?
500,000 by the end of October.
So if that rapid national testing system isn't in place by the end of October, national lockdown's inevitable, isn't it?
Is that people abide by social distancing, and then if you have a positive test,
it's not about the result, it's about whether you can get a test, because if that system isn't in place, this whole moonshot idea that was put forward by the Prime Minister, that system isn't in place by the end of October, we cannot work through coronavirus as it exists.
So there is not a link between the two. Testing, of course, helps, but the most important thing is that people follow the social distancing, and that if you get a test result, the importance of self-isolation to break the transmission of the virus. And testing, of course, is very, very important that people follow the self-isolation. And if you've been a close contact, so, of course the testing is important, but the first line of self-isolating if that's what's necessary.
Matt Hancock, Health Secretary, thank you for your time with us this morning.
It's very good to have me on. Thank you very much.